starting with one of your biggest decisions that you will make, choosing the right provider between an OBGYN and a midwife. And just because you think they're nice doesn't mean that they will align with your values when it comes to pregnancy and birth. Hello, beautiful people. I haven't said that in weeks now, so I'm really excited to get back. This is Birthing in Faith, a podcast for Black Christian women. I'm your host, Imani Fitch, and I'm so excited, very, very happy to be back for season 2. Number one, I'm proud of myself for continuing to do this because, just to be honest, I'm not the most, what is the word? I'm not the most committed to things. I'll just say it for what it is. I get really excited, and then as the excitement falls off, I taper off. And so I'm so excited, so proud of myself, so grateful to God that this is continuing. And that's how I know it is a God thing. Season 2 is starting back strong in February. That means it's Black History Month. Round of applause for Black people. With it being Black History Month, I wanted to give a little snippet of Black history. I've mentioned it before in an episode in season 1 when we're talking about the history of birthing in America, but I want to bring attention again to the wonderful, the beautiful granny midwives that have paved the way for birth as we know it. Granny midwives refers to Black midwives. These are the midwives that were around during slavery and even after that. In the 19th century, the early 20th century, granny midwives were the ones that were tending to births, whether it was enslaved people who were giving birth or plantation owners, white people, Black people. Granny midwives were the ones who were trained to attend births, and they were very educated, very knowledgeable on how to care for women during birth and during postpartum. They are the foundation of obstetrics in this country. When white doctors started to study and research childbirth and bringing it into the hospital, they went to the granny midwives to learn about it. They went to them to observe and to learn, and they took those skills, they appropriated them, took them to the hospital, and they phased granny midwives out by calling them unsafe and basically for poor people. They blamed granny midwives for the high rate of death in childbirth. That caused a great decline in trust and appreciation for granny midwives. They essentially were forced underground. And even to this day, the stigma that we have around the term midwife and the concept of midwives goes all the way back to slavery and the agenda against granny midwives. I really would recommend, if anyone is interested, I already have a list of resources where you can learn more about granny midwives. It was really heavy on my heart to give a shout out to the foundation of obstetric history in the US, to granny midwives. If you've heard of granny midwives before, I want to hear more about your experience. And if you've never heard of them, tell me something that really stands out to you about them. I would love to continue a dialogue about granny midwives, and we could talk about it more on my Instagram or my TikTok at Confident Care Birth Co. And this season, I thought it'd be really important to go back to the basics. I realized that I've been in this industry for at least 8 years. I'm very ingrained, I'm very comfortable, but I don't want to come in to this podcast with assumptions. I don't want to assume your understanding of things. Let's lay a foundation for learning and advocacy within the birth space from a very foundational level. And I want to go deeper into talking about building your birth team. So this season is going to be a lot of that. There's still going to be mindset episodes, and there's still going to be amazing interviews with wonderful women and their experiences within the birthing space. We're starting with one of your biggest decisions that you will make, choosing the right provider between an OBGYN and a midwife. There's a lot of misconceptions between these providers, so I want to dig deeper. We're going to bring some definitions and some considerations because this is a choice. And I feel like so many women, we go into this either not realizing that we have a choice or not even understanding what to consider when we are choosing. And as Black women, we have a unique consideration because it's not just about preference. This is about safety and respectful care. So let's dive in. As I bring up the topic of choosing your provider, what comes to mind? Because I know for me, it seems very overwhelming. There are so many doctors. There are so many options. I'm limited to an extent by my insurance. How do I determine what to even look for? Again, the questions in my mind are like boing, 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 boing. And so if you're anything like me, take a deep breath, calm down. Let's take it step by step. But first, of course, we have to go with the statistics because that drives why it's an important conversation. We have all heard it. You can hear it again in my episode in season 1. Statistics are horrendous in the United States for Black women. In general, women are dying way more than they need to be when it comes to birth-related matters. On top of that, Black women are dying at a rate that's like 3 to 4 times more than white women. Unfortunately, this is due to the system in place that is steeped in racism and bias, dismissive treatment from unhelpful standards set by insurance companies, and a lack of informed consent. Until we get help and change from policies and from lawmakers, we have to come within ourselves to make change on the ground floor. How are we going into scenarios with more education, more knowledge, more ability to advocate and pretty much make a shift and a change, similar to like when we boycott Target or boycott Starbucks. Our individual but collective approach makes a big difference. And I'm going to tell you how to approach so that you can make a difference for yourself in a way that's best for you and your family. So as we're going through this, I want you to ask yourself some questions. Like, you don't have to have the answer right now, but at least start asking yourself, because this will help you learn and understand your values as an individual. Do I want a provider who follows a more traditional medicalized approach, or one who sees birth as a natural process? First, how much do I want to be involved in decisions in my care? I think we need to define and articulate the differences between an OBGYN and a midwife. Notice how I did not mention a doula. This is something I get questioned about all the time. People ask me, what's the difference between a midwife and a doula? What's the difference between an OBGYN and a doula? Let's talk about it and let's make it very plain. A doula is nowhere mentioned in this conversation because a doula is not a medical provider. Doulas are support people. We do not go to any type of school to gain our training. The trainings vary as far as what is required to be called a doula. Your doula is an essential part of your medical team, but they should not be providing any type of medical care or services, not even a blood pressure check. Doulas are trained to provide information, but not provide medical advice. And they should definitely not be telling you not to listen to your doctor's medical advice. For example, in the same vein of blood pressure, here's a scenario. You have a doula and they're checking on you. This is how it should go. Your feet seem swollen. Let me give you a foot massage, help you get more comfortable, help you handle and manage that feeling of discomfort. Maybe let's do an Epsom salt bath, help your swelling to go down. I'll prop your feet up, but make sure you talk to your doctor because we know swelling can be a sign of preeclampsia. This is how it shouldn't go. You have a headache and your feet are swollen? Let me check your blood pressure. I think you might have preeclampsia and we don't want you to have any problems. Do you see the difference? One is helping someone manage their symptoms and also being aware of signs that could be a medical problem. And the other one is taking matters into their own hand and diagnosing or giving medical advice about a potential medical problem that they are not trained to know anything about other than signs and symptoms. So if you can't tell, I love my doulas. I think we are an essential part of a birth team, but I find that a lot of times in this birth space, you get doulas who are crossing the line and crossing the boundaries. But we'll talk more about red flags and doulas in another episode. Back to OBGYNs and midwives. So we have some similarities between the two. In my opinion, there is one main similarity. Midwives and OBGYNs are trained and certified to provide medical care for pregnant and non-pregnant women. Okay, now for the differences. We'll start with OBGYNs. So OBGYN is short for obstetrics and gynecologist. Obstetric side is going to be your pregnancy. The gynecologist side is going to be your women's health, non-pregnant related things. When it comes to birth, OBGYNs are highly specialized and trained to care for high-risk pregnancies. OBGYNs are generally covered by insurance and only provide care for births in hospital settings. Now, when we talk about midwives, first of all, there are several different types of midwives. And I'm going to have to read this because I went into the research. When I speak of a midwife, I'm generally talking about a certified nurse midwife or a certified midwife. And certified nurse midwife has completed a graduate level nurse midwife program and passed the certification exam from the American Midwifery Certification Board. And certified midwives are non-nurses who have completed a graduate level midwifery degree program and passed the certificate exam from the American Midwifery Certification Board. These are the midwives who are able to write prescriptions, who can work in hospital settings and birth center settings and home settings. They are the most versatile as far as where they can practice. And of course, it's going to vary state by state. But when it comes to midwives, when I usually refer to a midwife, that's what I'm talking about. Then we have certified professional midwives, and they have met the certification requirements of the North American Registry of Midwives, and they qualify for the exam by either apprenticing with a qualified midwife and completing an entrance level portfolio evaluation process, or graduating from a midwifery program or school. Then these midwives are attending home births. Then you have direct entry midwife has studied midwifery through apprenticeship, self-study, a midwifery school, or college university-based program that is not related to the discipline of nursing. Then you may also have a lay midwife, and that refers to an uncertified or unlicensed midwife who often has an informal education, such as apprenticeship or self-study, rather than like a program that they went through and they are practicing as midwives. Again, this is going to be someone that is attending a home birth. When it comes to how and where these midwives can practice, that's going to vary state by state. Also, if insurance covers, is going to vary state by state, and CNMs can provide GYN care and OB care. Like for me, I go to a midwife for my GYN care. At this point, I also want to add that just because you are seeing a midwife doesn't automatically mean that they have a holistic approach to OB care. It doesn't automatically mean that they are very natural minded when it comes to birth. It depends on their model of care. I have worked with midwives who are trained under OBs, and so they function in a medical model of care. I have also worked with midwives who are holistically trained, and so they function out of the midwifery model of care. These are questions that you want to ask when you're interviewing or considering a provider based on what your values are. To be honest, it's kind of how I feel about Black providers. Just because a provider is Black doesn't mean that they function with the mindset of how to care for Black people in the best way. A lot of Black providers, whether it's an OBGYN or a midwife, have been trained in a system, this medical system that is inherently racist. And so they're functioning from like a mindset that doesn't automatically see the nuances of what's important to care for Black people and Black women, especially when it comes to birth.
Hey, I wanted to take a quick moment and tell you about today's sponsor, Confident Care Birth Co. I hope something in this episode has got your wheels spinning a little bit. And if you are ready to take your birth journey into your own hands with confidence and faith in a support system, a strong support system behind you, let me introduce you to my company, Confident Care Birth Co., where I am the birth coach dedicated to helping you cut through the noise, make informed decisions, and helping you create a plan for your journey towards motherhood that truly aligns with your values, not just what the system expects for you to do. We are rooted in faith, backed by evidence-based education, and fully committed to supporting you and your family. From preconception, pregnancy, birth, postpartum, all of it. The goal is to equip you with tools, education, and confidence that will help you navigate this journey on your terms. So if that sounds like exactly what you need, go ahead to the website, www.confidentcarebirthco.com, or click the link in the description and book your consultation call today. Let's talk about how we can work together to create an experience that will be truly transformative, boost your confidence like nothing else, and build a foundation for you and your family that will reap benefits for years to come. I would love to talk to you today. All right, back to the show.
So when you're asking yourself these questions, what's most important to me? Now, there are a lot of stereotypes about OBGYNs and midwives, so let's talk about that too. And I'm going to bust some myths about them. Number one, OBGYNs only care about surgery and interventions. Absolutely not true. There are so many OBGYNs that support natural birth and will honor your birth preferences if you advocate for it. There may not be that many who have seen and have done things that like giving birth on all fours, but that doesn't mean that they're automatically against it. So I really suggest talking with your provider about it, engaging to see how they respond when if you're interested in more natural approach and you want to see how they respond to it. Another stereotype, all OBGYNs just want to do C-sections. That's a tough one, but it's not true. A lot of them do. A lot of them feel like that is the safest way for a baby to come if labor doesn't look just like how they expect it. But then you do have a lot of OBGYNs who are aware of the risks of C-sections and that the benefits don't always outweigh the risks. Again, this is a conversation. Something you can be asking your doctor is, what is your C-section rate? If they don't even know, that's a that's something to consider. But if they do and they like talk through their thoughts about C-sections, especially if you are maybe afraid of one or trying to avoid one. This is how you get the conversation going and feeling like a part of your care team, part of the decision making. And that's the goal. You want to feel as if you have that autonomy over your body and your baby, and that this person on your support team, your provider, is in alignment with how they can best care for you, of course, with their specialized knowledge at the forefront. So some stereotypes about midwives. Midwives are only for home births. No. You can see a midwife in a hospital, in a birth center, and at home births. The type of midwife, like I already talked about, is going to vary, but even the personality and the approach to birth when it comes to a midwife is going to vary. You could very well find a home birth style midwife in a hospital. I've seen that before. I've worked with one, keyword one, and it was a beautiful experience. She was wearing her Birkenstocks during a birth with no shoe covers. I was like, she's real granola. She's real crunchy. But that birth was beautiful. It was exactly what that mom wanted, but in a hospital setting. Another stereotype about midwives, that they aren't as qualified as doctors. Absolutely incorrect, because first we need to talk about what are they qualified to do. When it comes to low risk pregnancy, midwives are actually the specialists in that area. They have advanced medical training. I'm talking about certified nurse midwives, by the way. They have logged so many hours with vaginal births and a lot of times natural births because that is all they can do. Whereas OBGYNs, they are specialized in surgeries. They have to do GYN surgery, fibroids, also C-sections, but they have a vast knowledge of surgery. And so when it comes to quote unquote boring vaginal traditional births, they are often looking and waiting for some type of pathology to show up, meaning some type of issue to arise, some type of intervention to be needed. So if you're hearing a conversation about midwives not being as qualified for doctors, I think first we need to ask in what type of setting and what type of situation. It varies. Sometimes yes, sometimes no. When it comes to any type of provider that you're going to be choosing for your birth, whether it's your first time or your fifth time, let me tell you some things to take into consideration. Because like I said, it's not just about preference. It's about something that can make a big difference in your entire experience that could relate to every other experience you have in the future when it comes to birth, motherhood. I hate to make it seem so heavy because at the end of the day, God is the one that is presiding over you, covering you, protecting you, and guiding you. But when you have been given the opportunity and option to choose and to do your research, it is a powerful choice. And it's your responsibility to do your due diligence. Because I know you're tired of hearing Black women talking about how they were ignored, about how they had pain, about how they missed something. Choosing the right doctor, it makes a difference. So if you're listening to this and you're not even pregnant yet, this is a perfect time to be doing these soft interviews of your OB, or if you have access to a midwife, doing these soft interviews when you go in for your annual, or whoever's doing your pap smears. And yes, you should be getting pap smears. Just because you like this provider that you see once a year or maybe more often because you're one of those girlies that has a little bit more gynecological needs, that doesn't mean that you will like them when we're talking about birth and you're seeing them week after week after week and you're having to make more important decisions. And just because you think they're nice doesn't mean that they will align with your values when it comes to pregnancy and birth. I promise you, you're not hurting their feelings if you ask the hard questions. I promise you, you're not hurting their feelings if you leave and transfer to another practice. So as you're doing these soft interviews, here's some things that you can consider now. Do they listen to you, or are they ready to talk? You say one thing and they have an answer already. Do they dominate the conversation? Does it even feel like a conversation, or does it just feel like ask them what their C-section rates are? And for comparison, it's best if it's less than the national average, which at this point is about 30%. Another question is, do they support natural birth and do they offer alternative medications? This is important. Even if you desire an epidural, that's that's completely fine. That's if that's within your values. But if they don't even support it, that means they don't know much outside of their little silo. That could very well mean that they only have specific ways that they like to help women, and not much more outside of that. So that means not very individualized care. Also, I want to address, like, when we say that we like our doctor or we like our midwife, some people even say, I love my doctor. What do we mean? What are we judging that experience on? Are we talking about bedside manner? Are they bubbly, happy, easy to talk to? Because that's cool. That's important. Because they give you a prescription every time you ask for one or you need one. Because that's cool. That's important. But when you flip over to the pregnancy side, the birth side, that matters, but it doesn't really matter. Take the time to assess what are your values and then line up to see, hey, does my provider match and align with that? Or are they just funny? Do they care about giving me the information that I'm asking for? Or do we just live in the same neighborhood? Do they care about my autonomy? Or do we just have similar interests? We need to think about our approach to what we like about our providers differently, which means we need to be aware of red flags in our provider, things that are a sure sign that you need to transfer care. And like I said, transferring care is about you. It's not about your doctor and what they might think of you. It's not about your friends and what they might think of you. It's about you and your baby and your care. I have about 5 absolutely red flags for any provider that you don't even have to ask your friend. You don't have to ask your mom. You don't have to ask anybody. Go ahead and start looking for somebody else. Number one, if they're very dismissive. And I'm not talking about every now and then they might say, oh, that's normal. That's okay, blah, blah, blah. I'm talking about you have a provider where you ask questions, you have a concern, and they say, that's normal, don't worry about it. Or you ask a question and it requires an answer, and they say, this is just how we do. This is just what we do. Um, Everyone else is fine with it. That's dismissive. That means that's not individualized care. They don't see you as a person, as an individual. They are not open to your considerations, and they are dismissing your questions. You want a doctor or a midwife who's going to see that this is your body and your experience, and that will pacify you and make you feel comfortable in whatever decision needs to be made, or even just in your experience. If they're dismissing you in the office, they're definitely going to dismiss you in birth. And that's the last thing that you want to experience. Number two, if anyone is pressuring you to have an intervention, red flag. Get your papers and get ready to go, especially without medical necessity. If in labor, we're talking about an induction, a Foley, a C-section, an epidural, there should never be any pressuring or ultimatums placed on you when it comes to interventions. On the pregnancy side, we're talking about ultrasounds outside of your anatomy ultrasound. For example, if you're in your 3rd trimester and they want to do an ultrasound just to check how big the baby is, that's not medically necessary. So you can say no. Of course, you could say yes. And it could be up to your insurance whether they pay for it or not. But your provider should not be forcing you and pressuring you to do something like that. Number 3, they don't explain your options or risks clearly. That is called informed consent. They should be giving you the benefits, why they want to do something, the risks if you do it, alternatives, like what are the other options if you don't want to do that specific thing. They should be telling you what will happen if you do nothing, and they should give you the opportunity to think about it. If they're not doing those things, that is not informed consent, and that is a violation of your rights as a patient. It happens so much. It happens all the time because we don't know. and it sounds like a suggestion, or it sounds like this is the best thing you should do, but that's again not individualized care. They are assuming things about you based on one aspect, but they're not asking you and giving you the opportunity to think through maybe a holistic approach to this specific thing, this intervention. And that's a red flag. It's at least something to talk further about. For example, genetic testing, for example, an induction, any testing in pregnancy, especially anything like, say, an amniocentesis. And then when you're in labor, it's hard, but they should be giving you full information before you consent. Number 4, if your provider is rude, impatient, or rushes your appointments, they're not seeing you as a person. You are a number. That's what that means. And if it's like that in the appointments, imagine what it will be like in birth. And number 5, if you find out that they have a high rate of interventions without a reason, red flag. They are operating out of what's best for them and most convenient for them. And it's not, again, individualized care. So if you are experiencing any of these red flags and you want to know how to transfer care, first you have to make that decision within yourself. Sometimes it's a gut feeling. Sometimes it's like, oh, this is so bad that I'm scared, or I really don't even like going to the doctor because of how I feel when I'm engaging with this person. Um, if something feels off, go ahead and get ready to transfer. And you do that by finding a new provider first. Get to your recommendations, talk to people, find out who they liked, why they liked them, and call the office first. Call their office and make sure that they have availability, especially related to how far along you are. If you're not pregnant, it's cool. Usually you go ahead and establish care. But if you are pregnant, a lot of providers, they don't accept new patients up into a certain week of gestation. So the sooner the better, but you don't want to cut ties with your current provider before you have a new one. So you want to make sure you call first, make sure you can get an appointment, and then you request your records from your provider. You have the right to do that. They can go straight to you, like in your hand, or faxed to you, emailed, whatever, or they can be faxed straight to the new provider. I have heard of it before where when you say you want to transfer care, especially if you transfer, say, from an OBGYN to a midwife at a birth center, you get some bullying, you get some retaliation. You can even experience bullying by being told, if you transfer, you can never come back here. The red flags are just showing themselves. So I encourage you not to fall for those traps, but go ahead and realize you've made the right decision. Then after you send the records, make that switch as soon as possible. Obviously, the earlier the better, but hey, if you find someone that will accept you even as far as 37 weeks, that's better than staying in with a provider that you are very uncomfortable with based on the amount of red flags that you've seen. And yes, I've seen people transfer as late as 37 weeks. Because remember, your provider works for you, and so you got to go where you feel good. We've broken down OBGYN versus midwife, but how do you determine which one is best for you? There are going to be some limitations and some guiding factors when it comes to choosing the provider that's best for you. So some questions you could consider: what kind of birth experience do you want for yourself and for your family? If you're looking for like real low tech, home birth experience, you're going to go with a midwife. If you know you'll have to have a C-section, or if you are looking for an epidural, you want to go with a OBGYN, or you could go with a midwife that is in a practice with an OBGYN, but you're going to go with a hospital route. And so that's going to guide your decision there. What is my risk level? Thinking about your pre-existing medical conditions. If you're having multiples in your pregnancy, that's going to change your options. If you're low risk, midwife, you could go with the midwife all the way. But once you become high risk, the OBGYN is your safest bet. And as you assess your values, that probably is one of the highest value up there. And lastly, like, where do you feel most comfortable? If you feel comfortable in a hospital, shoot for OBGYN or a midwife that works with the OBGYN in the hospital. If you fear the hospital and you are low risk, shoot for a midwife in a birth center or a home birth. These are the things to consider as you're deciding, who am I going to choose as my provider to support me on my birth team? Your provider, an OBGYN or a midwife, is going to be your first decision on your birth team and one of the most important decisions in your birth team. I know that probably seemed like a lot, but hopefully I was able to break it down for you to at least start the process of thinking through things a little differently. Like, no more of this automatic workflow without a thought, without a stopping and skipping a beat. My desire for you, for all women, is to experience a level of autonomy when it comes to our care. And that first little step can be with choosing your provider. So whichever one you choose, you can actually feel comfortable moving forward with the care that you're going to receive for you and for your family. And as y'all know, confidence is the number one thing that I hope you all receive from this podcast and from engaging with me. So if you learned something new, I really want to hear about it. Let's connect. Hit me up on social media. And if you want even more personalized support, go ahead and email me or visit my website, www.confidentcarebirthco.com, because I'm all about building a birth team and helping you do that. If you love this episode, please share it with a friend. It really makes a difference in how my podcast will show up for other people. And it helps me know that you are actually getting good things out of the conversation. All right, that's it. Thank you for listening. Until next time.